Good evening and welcome to the Visiting Nurse Association Health Group's newscast with the special report. I am Pat Johnson. Tonight, we will feature Visiting Nurse Association's 2020 and 2021 Annual Community Impact Report, a look back on these historic and unprecedented past 2 years, as VNA continued to serve the community during the COVID-19 pandemic, rising to the challenge by caring for thousands of COVID-positive patients in their homes and administering life-saving vaccines to thousands more. We are joined now by Charlie Mason, our special healthcare correspondent. Tell us, Charlie, what kind of impact has VNA had during such a difficult time for so many?
Thanks, Pat. Visiting Nurse Association's impact these past 2 years has been nothing short of remarkable. The numbers are incredible when you think of the challenges they faced. Since the start of the pandemic, VNA has served the public on the front lines. Despite the risks, VNA clinicians have continued administering home health care, hospice, primary and community-based care to over 150,000 patients in New Jersey, Ohio, and Southeast Florida. A total of over 2,400 dedicated VNA employees, including nurses, physicians, home health aides, therapists, social workers, and administrative staff, dedicated themselves to providing the most compassionate and highest quality of care. 2020 brought a wealth of challenges, but VNA staff remained steadfast. Visiting Nurse Association's home health program cared for more than 42,000 patients through nearly 1 million visits, and its palliative care program saw over 4,500 patients through almost 15,000 visits. Visiting physician services continued seeing patients in their homes, making over 32,000 house calls to more than 5,000 patients. The Hospice and Advanced Care Institute made nearly 200,000 visits to nearly 5,000 patients. The collective efforts of VNA staff make for an impressive total of nearly 1.2 million patient visits, all in the midst of a global health crisis. Over the past 2 years, VNA has cared for over 4,000 COVID-positive patients. In fact, VNA staff courageously made over 48,000 home health and hospice visits to COVID-positive patients. Innovative new safety protocols were initiated to keep staff and patients safe, and over 9,900 telehealth visits were conducted with those patients, a major increase in a safe, effective, and less costly way to provide home care.
Wow, Charlie, that is truly impressive. Not only did VNA continue to provide vital and home services to COVID-positive patients, the organization made a major impact battling the virus through its vaccination efforts. With more on that, here is Jason Tyson, our COVID vaccine correspondent.
Once the vaccines were approved for the public, VNA went into high gear. VNA of Central Jersey Community Health Centers worked quickly, collaborating with community partners to set up COVID-19 vaccine sites around Monmouth County. Through September of this year, they administered vaccines to over 46,000 individuals, administering over 87,000 shots, and their work continues today. This year, more than 9,000 people, especially at-risk populations including seniors, low-income, and medically underserved individuals, were vaccinated through Visiting Nurse Association's Children Family Health Institute vaccine clinics in Middlesex, Monmouth, and Ocean counties. VNA piloted a home vaccine program providing 750 homebound patients in with the COVID-19 vaccine. This incredible, unprecedented program garnered national media attention and was featured on Good Morning America. In order to support the vaccination effort, VNA hired over 150 temporary employees, including nurses, scribes, registrars, and managers. On its busiest days, the organization had as many as 60+ people working across their vaccination centers. Early on, COVID-19 testing was provided and continues with over 4,500 tests to date. Back to you, Pat.
Amazing, Jason. With more on Visiting Nurse Association's financials for the year 2020, we're joined by Liz Hernandez, our financial correspondent.
Thank you, Pat. The Visiting Nurse Association's total revenue in 2020 was over $243 million, coming from Medicare, insurance, Medicaid, private care payments, grants, philanthropic support, and other sources. With these funds, VNA provided care to patients with home health, hospice, palliative, home-based primary care, private nursing care, community-based care, and digital health initiatives.
Thank you, Liz. So how else did the Visiting Nurse Association fund these major programs initiatives? With more on that, we're joined by our philanthropy correspondent, Bruce Kim.
Thank you, Pat. Back in March of 2020, VNA pivoted quickly to raise funds for the continuation of its healthcare programs while faced with sharply increased costs for protective equipment, supplies, and additional staffing. They established the Coronavirus Emergency Response Fund, resulting in unprecedented support from the community. Here's a closer look at the numbers. Over $2.2 million was raised in support of the fight against COVID-19, including a challenge matching gift of $1 million. A total of 880 gifts were received, including gifts from over 200 first-time donors. Unable to host special events, VNA ramped up alternative fundraising and was among the first organizations to go virtual, with more than 400 people viewing the Emerging Leadership Board's live music event. This was executed in just 3 weeks following the COVID-19 shutdown. The event featured VNA music therapists and local musicians and raised over $94,000 through online contributions. In October 2020, VNA hosted a virtual magic show, inviting families to tune in and participate in magic tricks performed by a comedian and magician, and raised over $103,000. During the height of the pandemic, public and private organizations donated $285,000 worth of personal protective equipment to ensure VNA staff were properly protected. For the first time in its history, VNA employees donated over 2,400 hours of personal paid time off to support colleagues in need, as well as over $47,000 to help colleagues and patients facing emergency financial situations. VNA of Central Jersey Community Health Centers received over $8,200 in the hashtag of gifts campaign to aid in providing care during the pandemic. The health centers were also awarded a New Jersey Department of Health grant of over $430,000 to address health disparities among high-risk and underserved populations. Philanthropic support of visiting nurse associations' fight against COVID-19 was only part of the incredible generosity VNA experienced in 2020. In total, over $6.5 million was raised, including over $2 million for COVID-19, over $3 million in private grants, including a generous $2.5 million grant from Parker Health in support of the Advanced Care Institute, and over $52,000 in planned gifts. Seasons of Hope raised over $61,000 in contributions and $16,000 worth of gift cards to help more than 750 families and children in need during the holidays.
Thank you so much for that report, Bruce. Incredible generosity. The VNA has achieved so much over these last 2 years, finding ways to continue to serve the community during this unprecedented time. Their future outlook is strong, and the need for their services has never been more necessary or relevant, with the increasing aging population and focus on high-quality, cost-effective care being provided in the patients' homes and community. While there still may be stormy weather ahead, with the COVID-19 pandemic and decreases in reimbursement, VNA will continue to be a leader in immunization efforts through its relationship with the community health centers and the Children and Family Health Institute. VNA will also continue to make employee health and safety its #1 priority. Attention will remain on the health and safety of colleagues, patients, and their loved ones to ensure all precautions are taken while caring for the most vulnerable populations. As we look forward to clearer skies ahead, the VNA is developing an exciting new 3-year strategy, focusing on the following core principles for the organization: grow our impact, sustain our success, and be the best. All of us here want to thank the VNA Health Group Board of Trustees, volunteers, donors, partners, and the dedicated staff for their continued commitment to sustaining a legacy of care and compassion that goes to the very heart of the mission of the VNA. Thank you for watching, and we wish you all a healthy and safe year ahead.